Innovation, commitment, courage. These are the legacies of Ivan Allen Jr., a man whose work and commitments led to extraordinary progress in this city that we call home. In accordance with Georgia Tech's mission to develop leaders who advance technology and improve the human condition, we give this prize in his honor by recognizing those around the world, like him, like you, who embody the best of those characteristics, even if it means risking everything. Dr. Fauci, Georgia Tech is honored to present you with the Ivan Allen Jr. Prize for Social Courage. In accepting this honor, you join a list of truly courageous individuals. We honor your exemplary career and your dedication in the fight against COVID-19. We thank you for your steadfast leadership so that we can have hope for ourselves, our families, our communities, our nation, and our world as we move forward. You are in fine company. Previous Ivan Allen Jr. Prize honorees include the late Congressman John Lewis, Dr. William Fauci, who led the strategy to eliminate smallpox, African civil rights advocate Beatrice Tetwa, United Nations Ambassador and former Atlanta Mayor Andrew Young, activist Nancy Parrish, U.S. President Jimmy Carter and First Lady Rosalind Carter, Charlene Hunter Galt and the late Dr. Hamilton Holmes, the first African-American students enrolled at the University of Georgia, and Georgia Senator Sam Nunn. In recognition of your courage, please accept this award from the entire Georgia Tech Yellow Jacket community.
Thank you so much for that very kind and generous introduction, Dr. Cabrera, and warm greetings to all of you assembled for this event. Reflecting on the courageous civil rights leadership of Georgia Tech alum Ivan Allen Jr. and the principled lives of all of the distinguished people who've received this prize before me, I'm deeply honored to accept the Ivan Allen Jr. Prize for Social Courage with gratitude and profound humility. Thank you very much. The wrenching events that our country has witnessed lately remind us that we have much work to do as individuals and as a country to overcome social injustices. Importantly, social injustices lead to health disparities. As made plain by the COVID-19 pandemic, the adverse effects of health disparities most profoundly affect people of color. As a physician, scientist, and public health official, my main goal is to preserve and protect the health and welfare of all Americans. U.S. global leadership in science means my responsibility extends to people around the world. In important ways, my education has shaped my life's work. I was fortunate enough and privileged enough to attend the Jesuit high school and college, and during college, I pursued a dual major in the classics and in pre-med. The Jesuit environment promoted intellectual rigor, including precision of thought and economy of expression. It also impressed upon us the most important way of serving the greater good, which with my affinity for the sciences led me to my career in medicine. My exposure to the humanities made me aware of health disparities at home and around the globe. One Jesuit precept we learned was always adhere to the truth, which has helped me preserve my integrity and also prove best for the people that I serve. Importantly, I have adhered to presenting science-based evidence and data as they are, no matter how inconvenient that truth might be. I can recall some episodes that I've had in my career in which choices may have called upon a certain degree of what one might call social courage. I was invited to brief President Ronald Reagan and Vice President George H.W. Bush about the HIV epidemic in the very early years of that pandemic. I told them the cold truth, realizing that they might either accept and respect me for what I've been telling them or get annoyed and never invite me back. However, good things came of that truth, because this led to a warm and respectful relationship with the vice president who later became President George H.W. Bush. He visited the NIH, understood the disease, and led to a relationship with his son, President George W. Bush. And so it was a typical example of, although the truth was inconvenient, the truth was accepted by leaders of our country. And then during the ACT UP protests, again in the early years of HIV, I made a decision to listen to what these HIV patient advocates and activists had to say. At the time, my research community and the regulatory community was still living in what we would call an ivory tower at this time. Colleagues were afraid of letting patients become partners, but this model of partnership between physician and patient has now become the norm, and community input is an important part of what we do. Finally, an example that falls more under the category of a moral imperative rather than moral courage was when I made multiple trips to Africa again in the middle years of the HIV/AIDS pandemic. And I had the realization of the moral imperative of bringing life-saving antiretroviral drugs to those most in need through what became the PEPFAR program that I had the honor and the privilege of designing at the request of President George W. Bush. The West African Ebola outbreak of 2014 to 16 was important because of the fear that it instilled in people in this country, despite the fact that it was never really a major threat to this country. And I made a decision to become part of the NIH Clinical Center team that took care of Ebola patients, mostly Americans who were volunteering in West Africa who became infected. I made a decision to take care of them, and I also made a decision to diffuse the stigma associated with this disease by taking the opportunity to publicly throw my arms around and hug one of the patients upon her discharge, proving that we should not stigmatize people who have been infected with Ebola or that who took care of people infected with Ebola. And during the COVID-19 pandemic, keeping public health messages attuned to the scientific evidence and data, and not being intimidated or pressured into agreeing with something that I did not think or believe to be true. And that continues to this day. And so thank you again for this distinguished honor. It has been an extraordinary privilege to serve as the director of the National Institute of Allergy and Infectious Diseases for now going on 37 years. And in that role, to have worked with 7 presidential administrations, as well as thousands of incredibly talented scientists, clinicians, public health officials, and importantly, patients, to preserve, protect, and advance the health and the welfare of all Americans and people worldwide. Thank you.
Thank you. Thank you so much, Dr. Fauci, and congratulations. And thank you for those meaningful words that will be a source of inspiration for many of us in this community. And of course, I want to offer my thanks again to Dr. Carlos Del Rio, who you will not see today, but following this Q&A session, he will be on a panel here with us, and I can't wait to continue the conversation that you and I are about to start. And so first, we are going to spend some time with Dr. Fauci, and we appreciate your generosity with your time to have this conversation about your career and thoughts on the current health crisis. Members of our student body, our faculty and staff, have submitted questions and are excited to hear from you. So I'll articulate some of these questions, and others we have videos where some of these people will ask their own questions. So to be a good scientist, one needs to be many things, right? One needs to be analytical, conscientious, undeterred, smart. Well, this year we have learned that one also may need to be brave, and there is a long history of bravery in science. What does it mean to you, this need to be brave in science?
Well, Dr. Cabrera, in the current situation where we're living right now, I think the idea of bravery in science takes on a special connotation because of a strong and growing anti-science trend that we're seeing, not only in this country, but even worldwide, where there is, in many respects, a frank denial of what is patently obvious from a scientific and public health standpoint. And I think we've seen that so clearly in the response of some individuals to the COVID-19 pandemic. It serves as a perfect example. So to me, bravery in science means to stick by the principles of what the data and the evidence tells you to do, to not pull back from that, to never compromise your integrity when you're dealing in a scientific situation, and to always, as I mentioned in my very brief acceptance remarks, to make sure you always stick with the truth, however inconvenient or uncomfortable it means to some people, because at the end of the day, the truth will always show.
Thank you. We have a question from a student. This will be also a Spanish exam for you. Hope you're ready for it.
Hola, mi nombre es Alejandro da Silva, soy una estudiante de tercer año de doctorado en bioingeniería y mi pregunta para usted, Dr. Fauci, es ¿cuáles son los principios que lo llevaron a la posición en la que está hoy día y que lo separaron de sus colegas en su carrera profesional?
So Alejandro is a bioengineering PhD student, and of course he wants career advice from you. If there are any principles that may have helped you throughout your career and that have, in retrospect, led you to be where you are today.
Well, thank you for that question. It's a great question, and it's meaningful to so many young people at that particular stage in their career. The principles that have guided me have always been to pursue what you feel passionate about what you really feel that you want to do, and not what you think other people may want you to do or think they want you to do. That's the first principle. The other is keep an absolute open mind to opportunities that might almost accidentally put themselves in front of you. And if you are alert enough, you can then seize these opportunities. You want to get a good background, a good education, to get good qualifications that you need by training. But once you have that, you are going to see, as I did in my own career, more often than not, the roads you follow are circumstances that you never would have predicted, but that just came in front of you as opportunities that will shape the direction of your career.
Thank you. Thank you for that advice. Now, before the pandemic, were there times in your career where you felt like you were taking great risk? I mean, you shared some of that insight during your remarks, but did you even think of yourself as particularly brave when you decided you were going to be a scientist?
You know, I'm smiling when you say that, Dr. Cabrera, because I certainly don't think upon myself at all as being brave. I just do what I feel I need to do, and I don't connect that with the concept of bravery. I've made some decisions that, in retrospect, were a bit risky. In the very much of the summer of 1981, I made a decision to completely turn around the direction of what was quite a successful career in medicine to pursue this very mysterious new disease that was appearing in our country, seemingly affecting a small number of mostly gay men. But I knew deep down that this was going to be much, much greater a problem than just restricted to gay men or even a small number of individuals. And my mentors told me that I was making a mistake studying this unusual, somewhat bizarre new disease. But nonetheless, I pursued ahead. And that has really been the defining element of my career, has been HIV/AIDS.
We have another question from a Georgia Tech student, Kyra Halbert Elliott. You want to play it?
Hi, I'm Kira Halbert Elliott, a third-year biomedical engineering major. Dr. Fauci, service can be infinitely rewarding, but it can also be extraordinarily draining. Can you elucidate how, over a lifetime of achievements and service, you have maintained your commitment to service? What moments inspired you? What moments shook your faith?
Well, that's what's a seemingly a simple but a complicated question. So let me try and be brief in the answer. What keeps me on course and not burned out or not discouraged is focusing like a laser beam on the importance of the problem that you're facing and that you're trying to tackle. It could be an individual sick patient who you most devote all of your energy and all of your skills to taking care of, which I have done thousands of times in my career. It could be a particular problem, like a new outbreak, like Ebola or Zika or now COVID-19. So the idea of focusing on what you need to do really goes a long way in getting you to not focus on fatigue and feeling worn out or feeling discouraged. Just understand the enormity of what you do. Often you can get stressed by things that are beyond your control. I think this past year, what I've gone through, I think anybody who witnesses it would have to see it would be quite stressful. I took no great pleasure in having to be in conflict at times with the President of the United States. I mean, that is not something that I seek to do. It just sometimes is necessary because you have to stick with the truth and maintain your integrity. That it was not an easy thing to do, but I had to do it.
So maybe as a follow-up to that, obviously the first few months of the response, and in some ways still this day, but the first phase of this response was extremely polarizing, even became very, very political. And have you experienced that level of polarization over scientific fact and realities before, or maybe any reflection that you have from this experience that hopefully teaches something for the future?
You know, I have to say, Dr. Cabrera, that I have been through multiple stressful situations, mostly in the form of outbreaks. There was stigma and there was some political issues related to other outbreaks, but I have never in my decades long experience ever seen the level of divisiveness that exists in the country today, where what should be normal, common sense, in some respects, no brainer type of public health issues have taken on a political connotation, which you don't need me to talk about. You just need to observe what is going on so clearly in the country today. That makes a lot of things difficult, but it is particularly problematic when you're dealing with a public health measure in which there needs to be a uniformity of a consistent response based on fundamental sound public health principles. And when you have divergence from that, because of the divisiveness that we have in society, that makes it quite difficult to do what you need to do to address something as formidable as this pandemic that we're dealing with.
And as you try to stay on message and have your voice heard, maybe any lessons from a standpoint of scientific communication or things that you've learned that worked well or didn't work as well? What can we learn from in that incredibly polarized environment that you just described? What can we learn?
Yeah. Well, I think you mentioned the word communication, Dr. Cabrera. Communication is really very important because when you have something as complex and as charged as this, you've got to be very consistent in being driven by the data. When the data change, as you learn more and more, you sometimes have to change your position, your guideline, your approach to something. So it isn't that you're changing your mind, it's that the data are changing and you have to stick with the data. When you communicate, I think it's really very important to know who your audience is and to know what the message is. Don't give a garbled message. Be very straightforward in what you're talking about. And as I always tell my fellows and students and others, if you're a scientist and you're communicating with the general public, the goal is not to show people how smart you are. The goal is for them to understand what you're talking about.
So, interestingly, and by the way, we were having a conversation before the program started, which I suppose with my colleagues and Dr. Del Rio, we will continue later, about this idea of being, how do you show confidence, which people are demanding, if you will, or needing in a situation like this, while at the same time being humble about what we know and what we don't know, and realizing that the evidence may change, that will, of course, change. Any advice on that? No, does it exist? Yeah.
It's just what you said. You've got to be modest enough and humble enough to know that you don't know everything you need to know at any given time, particularly when you're dealing with a dynamic situation. And a pandemic like we are all living through is a very dynamic, fluid situation. If you're talking about something that's static, then you could be very firm and definitive about things because they're not going to change. But when you're dealing with a fluid and dynamic situation, you've got to be flexible enough to, when you are confident of the data, to present it in a way that instills confidence in the people that you're talking to. When you do not know all of the information, you've got to be very clear that what you are giving is something based on an opinion and not necessarily on sound scientific data. Always distinguish and clarify what you are talking about and what the basis is of what you're saying.
And I guess as faculty members, especially at the beginning of our careers, many of us have been really worried about that one question that we don't know how to answer, right? And what is that way of addressing that? And sometimes we probably dread that moment, not realizing that something as easy as saying, I don't know, would probably do the trick, isn't it?
Oh, absolutely. I mean, you should say that every once in a while just to keep it fluid in your lips. There's nothing wrong with not knowing at all.
We'll practice that. We'll practice that. Let us go back to there's another question from a member of the Georgia Tech community that we pre-recorded.
Hi, Dr. Fauci. My name is Nettie Brown. I'm a third-year biomedical engineering PhD student here at Georgia Tech, and my question is, there's been a lot of recent discussion around vaccine hesitancy in the Black community based on medical mistreatment in this country, yet recent polls show that white Republicans have more vaccine hesitancy. This is probably due to politics. So my question is, since they are a larger demographic, how should we push white Republicans to push towards getting vaccines to help our nation move forward? Thank you.
Well, thank you very much, Natty. That's a really important question. It's really kind of puzzling how you have groups of individuals who seemingly, based on what's political ideology, are against vaccination. I don't understand that very well. When you have hesitancy in the African American community and the brown and Black community, you respect that hesitancy because it's based on the fact that in reality, that demographic group has been mistreated historically by federally sponsored medical programs. We all know about the shameful situation with Tuskegee and even beyond that. So when I deal with African Americans, I show respect for their hesitancy and respect for their concern. And then, after I make it clear that I understand why they are hesitant, I go through trying to figure out what is it about vaccines for COVID-19 or vaccines in general that make them hesitant. One of the most common one is, you went really very quick. I thought it takes years to make vaccines. You did it in less than a year. Was this cutting corners, and is it not safe? And you explain that the speed is not related at all to cutting corners, but is a reflection of the extraordinary scientific investments that were made and the exquisite nature of the scientific advances that have taken place years before we started working on this vaccine. The other thing is, are we sure it's safe and effective? And we talk about the independent bodies like the Data and Safety Monitoring Boards that independently look at the data and tell the public as to whether or not it's safe and effective. When they understand that, it's very interesting that you're seeing less and less hesitancy. I worry more about getting equity in access to vaccines for brown and Black people, because we want to make sure that they do have equity in access. With regard to the question about the reluctance of a disturbing proportion of Republicans of not wanting to get vaccinated, I really would like to learn a little bit more about that from them, about what is it about this particular vaccine or getting vaccinated against with a life-saving intervention. What about that do they have a problem with? And hopefully we can get into some sort of a productive dialogue about that.
That might be a good advice for us in our own personal lives, because all of us confront those conversations very often, right? With family members, with neighbors who may express that reluctance or hesitancy, and we don't know exactly where that might come from. But sometimes we have a sort of an immediate reaction of trying to preach or to, sort of dump all the arguments, and that, in my experience, hasn't worked very well. And maybe this idea that you're proposing, do you think it would work in that person-to-person conversation, or just trying to ask, what is it that makes you wary?
Of course. I think that's the only, if you confront someone that's the easiest way of turning them off even more. So you've got to try and reach out to them and have them explain and try and perhaps to go back and forth with them about why you feel that the risk benefit ratio very, very strongly weighs in favor of the benefit.
There was a very interesting article in the Washington Post recently about the many people who sort of take a selfie when they're doing the vaccine and they post it online. And some people get upset, say, why do you take a selfie, and whatever. And then some people is like, well, actually, if it encourages others to take it. I'm very excited because I'm planning to take my vaccine this week. And I was wondering, I mean, saying, you know, I have a public job. Should I document that and share it and use social media and tell people, hey, I'm taking the vaccine. I trust it. I think it's safe. I think it's very important for my health, for the people around me. What shall I do? You're my communications advisor all of a sudden.
You know, I would suggest that you seriously consider doing that, because as the president of a prestigious university, I think that there is going to be a substantial number of people who could be influenced by seeing you in a leadership role do that. So I think that would be, well, I did that myself. I had the press take a picture of me getting vaccinated at a time when there was even more concern on the part of people whether it's safe. Now that there have been over 107 million vaccinations given in this country, with 10% or 12% of the country fully vaccinated and over 20% having at least one vaccine, people feel much more comfortable about it. But back then they didn't. And for that reason, I did have a picture of a nurse putting a needle in my arm, giving me a vaccine.
Well, and then the other part of this interesting conversation that we're all having is, well, first of all, I don't even know if it's appropriate when in casual conversations we ask, have you been vaccinated or not? And then if you ask the question, then the next question is, which vaccine did you take, right? And does it matter, first, does it matter what vaccine do we take?
You know, it does not, because we have now 3 vaccines, Moderna, Pfizer, and J&J, who have been given emergency use authorization on the basis of a very high degree of efficacy in preventing mild to moderate disease and a very, very good track record of preventing severe disease, including hospitalization and death. You shouldn't be trying to compare one with the other. The only way you can adequately do that, if you compare them in a head-to-head comparison in the same clinical trial. And that wasn't done. So just know that we are very fortunate to have 3 highly efficacious and safe vaccines. So my recommendation is go to a facility near you or one that calls you and says you're now eligible to get vaccinated, and whatever they happen to have, take it, because it's important, first of all, to get vaccinated, not to wait 2 weeks or a month for the one that you think may or may not be better. Take the one that's made available to you.
Although if they give me the Moderna, they gave me 2 shots. Johnson & Johnson only 1 shot. Shouldn't I want the one that gives me 2 shots? Seems like I'm getting more stuff.
Well, no, actually, that's a good question. If you prefer to have a single shot and you go to a facility that has both of these available, the mRNA and the J&J, you could say, I would prefer to have the J&J because I only want 1 shot. There's nothing wrong with that.
Got it. I appreciate that. Let's talk a little bit about science, because you know we've had that experience. You know, we are a pretty research intense institution at Georgia Tech, through a whole host of disciplines, including by the way in biomedical, bioengineering, biomedical engineering. We have this great partnership with with our friends at Emory. But a lot of the science, it builds gradually over time, right? I mean, this amazing technology around messenger RNA that has given us these two vaccines in record time, which it's just unbelievable, the technology. But as you mentioned earlier, I mean, there's been years and years and hundreds of people and hundreds of doctoral dissertations and postdocs and papers and work building up all that research until all of a sudden one day all that knowledge was called to pretty much save us, right? A message maybe to folks here in places like Georgia Tech who are studying science, who have decided or are considering getting a doctorate in science, and who are going to be working on, small pieces of bigger puzzles. Anything you have to share with them?
Oh, absolutely. And I do this very frequently with people here at the NIH and others throughout the country, is that if you are part of a scientific enterprise, even though you may be working on a very small element of that, you should realize if you go to 40,000 feet and look at virtually every important biomedical intervention is always rooted in fundamental basic research that at the time seemingly had little bit to do with what it ultimately had a major impact on. And there are so many, many examples of that. People working on receptors on the cell for lipids and triglycerides and other areas and other elements of the body's ability to get involved in metabolic processes led to drugs that have important impact on diminishing the risk of cardiovascular disease, the lipid-lowering agents. People like David Baltimore and Howard Temin working on this reverse transcriptase enzyme years and years ago, what impact that ultimately had on molecular biology and understanding HIV. People in the laboratory working on RNA, realizing that messenger RNA can actually be a platform for vaccinology. We could go on all day giving examples of people working on very, very specific issues that ultimately get translated into something that could be transforming when it comes to personal and global health.
Yeah, in our experience this year at Georgia Tech, and I'm sure it's not the exception, and many other institutions like ours across the country, across the world, that they've, I'm sure, experienced similar things. But very early on, our faculty, some of the ones who will follow this conversation on a panel, they came to us and said, listen, to be safe, we've done all the statistics, and we need to test everybody every week. I say, okay, well, that's a very interesting idea, except that we don't have a medical school. We haven't done a clinical test in our life, never. How are we going to go from that? I do the numbers, how are we going to do that? They said, well, we can figure this out. Then my concern was, again, if we use the nasal swab, I haven't had the pleasure, but I understand from many others that once you do it once, you don't just repeat it for pleasure. She said, no worries. In very short time, my colleagues came together. They designed this, way of extracting RNA from saliva, which my understanding is not the easiest thing to do, in a massive way, scaled it up. They used this double pooling process, so whatever capacity we had, we could do many, many more tests by double pooling, and I don't know, they've done some crazy stuff. They programmed a platform. Oh, this is not just a plug. It is a plug. I'm very, very proud of what they did. But it is to say that this experience, honestly, showed, first of all, brought all these disciplines together and gave us this incredible sense of impact. What we do matters. That you may not realize it at the time when you're working every day in the lab, but when things got really ugly and scary, science and technology was all we had. And it was somehow, this is more of an open reflection, not necessarily a question, but I'm trying to figure out, how do we keep the spirit? There are lots of things of 2020 that we want to leave behind as fast as we can, but how do we keep some of these profound lessons that we've learned this year and keep them going? Anyway, don't mean to, I guess I'm too late, but if you have any thought about that.
Yes, I'm very impressed and feel very positive about what you just said. So you semi-apologize for it. You shouldn't, because that's exactly the spirit that you really want to foster in people who are in science. It's exactly what you said. If you look at what is rescuing us from a public health challenge, the likes of which we haven't seen in over 102 years, it really is the science. It absolutely is the science, just as you described, how people can get involved, put everybody together as a team, working to solve problems that really didn't exist a year ago. And yet you have to adapt to that. So to me, that's one of the beauties of science. Again, the mystery of it, the solving of the mystery, and the impact that you can have. Enormous impact involving the saving of literally millions of lives.
And it is fascinating. And one of the ideas that we're working on, and our executive vice president of research and our provost are in attendance, and several of our faculty leaders, we're thinking about even maybe creating a center around sort of a rapid response center. Like, can we develop techniques to sort of deploy rapidly science and technology for things that may come our way, which we cannot even predict today. So it's fascinating. We have a vaccine question from a faculty member.
Dr. Fauci, thank you for your service to our country. I'm Vinayak. I'm an assistant professor in the College of Sciences in the schools of chemistry and biochemistry and biological sciences. My question to you is the following. COVID-19 is caused by a virus that mutates. If so, are we looking at a vaccine shot yearly, just like we do for the flu? And if yes, can the COVID-19 vaccine and the flu vaccine be combined in a single shot? Thank you.
Well, that's an excellent question, often asked. It is entirely conceivable that if we have the continual emergence of new variants, that we may need to either boost with wild type to give a bigger and larger response of antibodies that could spill over and affect the variant. Of course, we know that our vaccine right now is very good against the 117 variant, not necessarily as good against the South African 351 variant. But we may actually need to intermittently boost. If that is the case, and it turns out, and that's a big if because we don't know, but if it does turn out that we need to boost intermittently, it is entirely conceivable that you would want to combine that with an influenza vaccine on a yearly basis. I hope we don't have to do that. I hope we can control and ultimately crush this particular infection so that we essentially eliminate it the way we've done with the eradication of smallpox, the elimination of polio throughout most of the world, and the elimination of measles in most of the developed countries in the world. But we don't know. We don't have enough information right now to know whether or not we're going to have to come back with booster shots, which is the reason why we follow it so very carefully, literally in real time.
And we have another question from a member of the Georgia Tech community. You want to play that?
Hi, Dr. Fauci. My name is Jathan Caldwell, and I'm the External Vice President of the Society of Hispanic Professional Engineers here at Georgia Tech. My question for you is, with healthcare in the United States still perpetuating one of the greatest areas of inequity for communities of color, where do you see the most opportunity for progress? Thank you.
Yeah, well, that's a great question that we deal with literally on a daily basis, because as with other diseases, this has done this very much by shining a very bright light on the disparities that we see among brown and black people and other minorities. We see it with COVID-19, not only in the incidence of infection, but also the fact when individuals become infected because of the increased incidence and prevalence of the comorbidities associated with demographic groups like African Americans, Hispanics, Native Americans, Pacific Islanders. They have a greater chance of having a severe outcome of their infection, namely hospitalization and death. So there are things we can do right now by increasing the equity and eliminating the disparity of accessibility to vaccines, to testing, to health care. But when I look at the problem, which has been around literally for decades and decades and decades, you don't eliminate the social determinants of health overnight. You have to have a decades-long commitment that you are not going to allow these disparities to remain the way they are right now. And again, you can't turn a light switch on and off with this. These are things that brown and black people face from the time they're born. Availability of proper diets, economic situations, situations where they live, the kinds of work they do. We've got to make sure that those social determinants of health, in many respects, are equalized so that decades from now, we don't have African Americans with a higher degree of diabetes, obesity, hypertension, chronic renal disease, chronic liver disease. Those are not racially determined. They're determined by the social determinants of health.
So I don't know if Dr. Rochelle Walensky is already available. Pardon me? She's on.
I see her somewhere.
Ah, you see her.
Yeah.
Dr. Walensky, I always joke that I had a poor sense of timing when I accepted to become president of Georgia Tech 4 months before the pandemic hit. I think you beat me in terms of timing. Of course, Dr. Fauci had no choice. He already has his job when the pandemic hit. But Dr. Walensky agreed to serve as the new director of the Centers for Disease Control and Prevention. And she is, and we're very appreciative for her to take the lead in such a crucial organization, just in absolutely the most important time. She is a physician scientist as well, who also serves as the administrator for the Agency for Toxic Substances and Disease Registry. I thank Dr. Walensky for joining us today. We're glad to have you join our discussion. We're very excited to hear your point of view from your vantage point at the CDC. Oh, we may have lost her. We let the technology genies fix the technology, and since we're Georgia Tech, I'm sure we can do that. We'll fix this. But I do have another question that I had for you, which is, especially the onset of when we were in the, I guess, in the darkest days in last summer, and at least here as we were getting ourselves organized, it seemed very hard to create an understanding of the importance of community health to individual safety and economic security. There was the sense that either you had to be for the economy or you had to be for health. I mean, we sort of got stuck in these very interesting, what I considered to be false dichotomies, but I couldn't sort of somehow figure out how to get us away from that. Why was it so hard to connect personal safety, community safety, economic security?
Well, in reality, it is a difficult issue. So putting aside the divisiveness, which I mentioned a bit ago, and just look fairly in a way of that tension between wanting to do the best for public health, but doing it in a way that if it is persistent over time, you are going to have a negative impact on the economy. Now, if you do that for a couple of weeks or a month, it's not going to have a significant impact. But the extraordinary nature of this outbreak required not only us here in the United States, but virtually every country in the world to essentially shut down, which, if done over a prolonged period, has a very negative effect, not only on the economy, but also on things like schools and having children not being able to safely go to school. So those are the things that it's a tension that you have to deal with. And I see Dr. Walensky back with us, that she and I are challenged by that literally every single day, because we're constantly being asked about that balance between preserving the public health tenets, the masking, the physical distancing, the avoiding crowds, versus what impact closing down certain things has on the economy. And you've got to make sure you preserve the public health at the same time that you're sensitive as to what you're doing, the impact on society. And here she is. I'm so glad to see her.
Yeah,
Hi, Rochelle.
Dr. Walensky, I'm sorry that I think you missed my introduction. It was wonderful. Other than I question your sense of timing for taking on this job, but we welcome you to Atlanta, and we celebrate that you agreed to take the lead of this organization at this absolutely essential time. And I know you wanted to share a few thoughts with us, and we're very appreciative that you join us today. So please go ahead.
Thank you so much. I'm sorry for the technical challenge. Thank you so much, Dr. Cabrera. I'm so happy to join in this well-deserved recognition of my colleague, my mentor, my hero in truth, and my
Oh gosh, we were about to hear the. Let's give it a second. Let's give it a second. I might need to recruit Dr. Del Rio to join me here, but just warning you, Carlos. Let's give her a second. It's, by the way, it's fascinating because as people like Dr. Walensky are moving into Atlanta, and in fact, I just said hello earlier to Paige Alexander, the new head of, oh, you're there, Paige, the new head of the Carter Center. And he's like, we haven't even had a chance to meet in person and to create the community that that is so essential. So anyway, we're going to find ways to start building community and to welcome Dr. Walensky as she deserves. The other thing, by the way, which I'll give you a good reason to come in person, Dr. Fauci. I have an excellent intelligence service here at Georgia Tech, and my understanding is that you love a good hot dog.
I do.
Well, I don't know if
particularly at a baseball game.
You do. Okay. Well, I don't know if you're aware that we have the world famous Varsity, the home of the best chili dog in the galaxy, is within walking distance from this venue. So what I can tell you is that I promise you that whenever we can have you in person to come to Atlanta, I owe you that one. It's actually a terrific place.
I'm convinced.
Was my intelligence correct, or did I miss it? No answers. Okay, so let me perhaps there's another question that we have for you that was taped earlier from the Georgia Tech community. Maybe we'll go to that now from Aaron Levin. See if we can play that.
Dr. Fauci and Dr. Walensky, thanks so much for joining us today. My name is Aaron Levine, and I'm a faculty member in the School of Public Policy. One of the striking realities of the pandemic is how it's highlighted existing disparities in our society, with, for example, Blacks, Hispanics, and Native Americans dying from COVID-19 at much higher rates than white Americans. And now it appears some of these inequities are appearing in the vaccination data. My question is, what can we do to prioritize vaccination among those most affected by the pandemic?
Yes, thank you for that question. And that is something we are paying very strict attention to, is to get the equity such that we completely eliminate this disparity of access. And here are some of the things that the president himself has spoken about explicitly: putting up community vaccine centers as well as community health centers, and making sure that they are equitably distributed in locations which have a high density of a demographic group such as African Americans, Hispanics, and other minorities. To get vaccine doses to pharmacies that are located in areas that have a high concentration of this demographic groups, to make sure we have mobile units to get to poorly accessible areas that are very often disproportionately populated by African Americans and Hispanics. And finally, to get more vaccinators, be they military, retired physicians, nurses, and other healthcare providers, to make sure we can get out into the community and get these people vaccinated so that you don't have a disproportionate number of them being unvaccinated, which is completely unacceptable. So those are the kind of things that we're doing, because what you asked is a very, very important question. We do not want to have health disparities be translated into lack of access to the vaccines that were available for them. Very important question and very important point.
All right. Well, we have one last question from a student, from Lydia. If you want to play that, please.
Hi, Dr. Fauci. My name is Lydia Wiederholt, and I'm a second-year public policy major. I wanted to know, based on your experience with the COVID-19 pandemic and your work with the HIV and AIDS epidemic, what do you feel our country and world should do to better prepare for similar health challenges in the future? Thank you.
Thank you very much. There are several things that need to be done at the global and domestic level. At the global level, we have to strengthen our security network, the global health security network, where you have communication, transparency, and cooperation among all countries of the world in order to be able to detect outbreaks at the very early stages. You have to build up the public health system that we've let essentially go to some form of attrition over decades. We need to rebuild that. And we also have to make investments not only in public health infrastructure, but in scientific basis. For example, the things that got us the vaccines that we have right now. So it's an investment both at the scientific level and at the public health level, both domestically and internationally.
All right. Good timing, Dr. Walensky. I hope we figured it out already.
I'm nothing if not tenacious.
Yeah, absolutely. Thank you for not giving up on us. And the floor is yours.
Thank you again, Dr. Cabrera. And I am so happy to join you in this well-deserved recognition of my colleague, my mentor, my hero in truth, and my friend. On behalf of all of us at CDC, I extend hearty congratulations to you, Dr. Fauci. We consider you a member of our extended family, and I can think of no one more deserving of the Ivan Allen Jr. Prize for Social Change than Anthony Fauci. This prize, in honor of the late mayor and Georgia Tech alum, perfectly captures Tony's resolve during the COVID-19 pandemic. He's been a rock of principle through incredibly challenging circumstances. Throughout his unprecedented time in our history, Tony has become known as America's doctor because he's done something bold and audacious. Simply put, he's told the American people the truth, even when it was inconvenient to do so. He's spoken to us in simple, straightforward language with his characteristic Brooklyn accent that reminds me of my own mother, using every possible platform available. He's become a reassuring presence in otherwise uncertain times and a voice of reason and common sense. Although he's become famously ubiquitous during the COVID-19 pandemic, those of us in the field of infectious disease world have known him to be a steady drumbeat of truth throughout his illustrious career. I told Tony this anecdote the last time I introduced him when he gave medical grand rounds at Mass General. I can vividly remember the first time I met Dr. Fauci. I was giving my first oral presentation at the retrovirus conference, and Dr. Fauci came up to meet me afterwards, shook my hand. I was shaking. I shook his hand, and then I turned to a colleague and I said, "I'm never washing that hand again." And that was from an infectious disease doctor. We in the field of infectious disease are not at all surprised that he has risen to the forefront in this time of crisis. He has done so many times before. During the HIV/AIDS crisis of the 1990s, as I was starting my own medical career working in hospital wards in Baltimore, he was leading the revolution to treatment. In fact, and he just told you this story, he opened the door to a new paradigm of patient advocacy and giving community a voice. When AIDS patients and their loved ones were protesting in die-ins outside his office at NIH in the 1980s, Tony's response was, "Please let them in. I want to hear what they have to say." This moment of openness, this moment of humanity, changed the course of advocacy in health and set the stage for having community and patient members on guidelines panels and advisory committees. It is such a critical voice that we listen to every day now because of that one act from Tony. Since those dark days when AIDS was a certain death sentence, we have witnessed the evolution of a deadly disease become a chronic one, where people not just manage, but thrive, thanks in large part to the efforts of Dr. Anthony Fauci. Any infectious disease has a worthy opponent in Tony because he never gives up. He never gives in, and it is my privilege and honor to work alongside him now on the White House COVID-19 response team. He's truly deserving of this award, and now I look forward to joining the conversation. Thank you.
Oh,
Congratulations.
Thank you so much, Dr. Walensky.
Thank you, Adele.
So, well, I mean, just the way you felt when you met Dr. Fauci, I think that reflects the way many of our students would look up to you, Dr. Walensky, in your current responsibility. So what would be, this is a question for both of you. What's your charge to this new generation of students, again, at Georgia Tech, but in institutions around the world, who may be studying basic science, or they may be studying bioengineering or computer science or public policy, or any other area based on what we have learned? What's your charge? I mean, you are our heroes. We look up to you. We have, so what is the charge that you have for this generation, this new generation?
Go ahead,
It's
Michelle.
very simple question.
All right. You know, I am personally an infectious disease doctor because I was motivated by people who were dying in front of me in the mid-1990s because of HIV and AIDS. And I would say I can imagine this generation and your students will and should be motivated by this period of time and what is happening in this period of time. And it's a coalescence of a pandemic and people dying in that pandemic, and true inequities and how we care for people in our society, and how health is so disparate. And so I would say to be inspired. I am going to spend the rest of my career trying to do good in global health. I'm going to spend the next few years getting us out of this pandemic. I hope it won't take that long. And to then make up for so much of the collateral damage that has happened because of this pandemic. But the health inequities have taken decades and centuries to occur, and it is not necessarily going to be me that is going to it won't end with my career. It has to end with young people being motivated by seeing what is happened during this pandemic and working to get us all improve health for the whole world, and to solve some of these inequities that have happened.
Thank you so much. And you, Doctor?
Yeah, well, certainly to just underscore and agree totally with what Dr. Walensky has said, but for the students of Georgia Tech, listen to what Dr. Walensky had said, but also for your own personal feeling of what you do. Not every scientist at Georgia Tech is going to be a biological scientist because you go well beyond biology. Just the idea of the field of science. Dr. Walensky and I get our thrill in the discovery and the implementation of things that maybe were not known 10 or 15 years ago and applying it to health. As a scientist, be it in the biological sciences, the life sciences, the physical sciences, the idea of discovery, of learning something that maybe was never fully appreciated before, is such an extraordinary positive feeling. We get it when we take care of a patient and we see the patient get better. We get it when we see something happen, for example, having an outbreak turn the corner and come down. Those of you in other areas of science are going to get the same sort of a thrill when you do something that advances your own individual field. So I just can't think of anything more exciting than being in the field of science, whatever area of science you're in. If it suits you to be in science, there's nothing more exciting in my mind than that. So go for it.
Thank you both. And Dr. Walensky, just I was joking earlier when I talked about your poor sense of timing, but actually, when you were offered this position, which I know from a professional standpoint must have been an honor of a lifetime and a career, but when you saw how hard it was for people like Dr. Fauci to stick to truth, to be that voice of science, and when you saw some of the reactions that he was getting, that must have given you some pause. So we had lots of questions for Dr. Fauci earlier about his sort of source of courage. Where did you get yours to say, yes, I'm up for the challenge? Bring it on.
I'm not sure it went exactly like that. When I received the phone call, I was surprised, I have to admit. I wasn't expecting the phone call saying, come lead the CDC. But what went through my mind is somebody feels like I can be helpful in making a difference here. And the answer can't be no, because we're in a really bad spot. And if I can be helpful to make a difference, then that's my job. That's what I have to do. I have a wonderful female mentor who said, any next job that you're not too scared of, a little bit scared of, isn't big enough for you. So I was a little bit scared. I remain a little bit scared. But in fact, this is a big job, and we have a lot of hard work. I have an incredible mentor in Dr. Fauci, who's been helping me through it, and an incredible team at CDC. I also have been very clear, and was very clear when I started, that they were going to get my honest opinion, whether or not they liked it, and that they were going to, and then I wanted to be sure that science was going to be leading the way, and that I was going to be able to convey that science. So with that acknowledgement and that support from the administration, recognizing that I had the permission to let science lead the way, and that in fact they endorsed it, and with the knowledge that people around me were going to support me, and that someone out there thought I could make a difference and make things better, then the answer was an easy one.
Well, thank you so much. How I wish I could be a fly on the wall when the two of you meet by yourselves to discuss what's going on. And make you replicate those conversations here. But if there is something that you would like to ask each other for the pleasure of the rest of us, this might be a good moment. Or any closing comments, just to make it a little easier. Any closing comments that each of you may have. And I'll start with you, Dr. Walensky. So we'll give the last word to Dr. Fauci.
You know, what I've been charging my team with is to ask the hard questions, to make sure, are we asking the most important scientific questions, to challenge the norm and say, is this the best that we can do, and what is getting in our way, so that we can actually do things better. We're spending an extraordinary amount of time on how we reach hard to reach populations and how we achieve access, proper access. I keep using the word sticky. I want to make sure that as we do that, our actions are sticky so that we can go back and reach those populations for blood pressure control, for many other things, for access in all areas of health and society. And so I would just say, ask the big questions, pursue what keeps you up at night, because you want to pursue that big scientific question. And I'm just so very grateful for the team of incredible scientists I have around me, and that very much includes and is led by Dr. Fauci.
Well, thank you very much, Dr. Cabrera. I just would like to close my own comments with saying I very much appreciate having been chosen as the winner of the Ivan Allen Prize for Social Courage for this year. But whenever you get a prize that calls you out as an individual, you absolutely, at least I know, and I sincerely mean this, all it does is remind me of the extraordinary group of people that I'm surrounded by, that I deal with every day, including and particularly Dr. Walensky, who has been very generous in her praise of me, but she is, by anybody who has anything to do with her, knows that already she's emerged as a superstar in this endeavor that we have. She's at an organization that's an extraordinary organization. I mean, the CDC, who over the last year has taken some hits, is a phenomenal organization. We are lucky in this country to have the Centers for Disease Control and Prevention, who are leading us now towards the end game of getting out of this pandemic. The same holds true for all of my colleagues at the National Institutes of Health. I mean, I get a lot of attention, but there are thousands of my colleagues who are there doing what it takes to get the job done, not only at the NIH, but the grantees and contractors who are NIH grantees, of which Dr. Walensky was one not too long ago. That's the team that I think our country needs to realize, that you may see one or two of us around, but the fact is that there are thousands of us at the CDC, at the NIH, at other organizations that are really pulling to get the country out of this terrible outbreak that we're in. So I feel very privileged to be a small part of that extraordinary team. And including what Rochelle mentioned, the amazing team we have now at this administration, the medical team that we deal with every single day, literally every single day, is both a pleasure and an honor to do that. So I feel very, very good about what's going on. So thank you for giving me the opportunity to make those comments.
Thank you both. And please know that as scientists, as researchers, we respect you, we appreciate you both. We need you to be widely successful. You know, there's a bright light at the end of the tunnel, but we're still in it. And we're here to help. Dr. Walensky, we owe you a warmer, more personal welcome to Atlanta. We will plan something fun for you. Dr. Fauci, we owe you that world famous hot dog when we can arrange your next trip to Atlanta. And but again, congratulations on Dr. Fauci, and thank you for a lifetime of social courage from which we're all benefited. Hearing your story and your insights have left me, all of us, really feeling encouraged, inspired, and optimistic. We're so grateful for the time we've had with you today and look forward to a day when we can gather in person. Thank you both very, very much for your time today. We much appreciate it.
Thank you.
Thank you.
Thank you very much.
Thank you.